Do you know someone that's really gifted technically but can't relate to people, and they take everything that is said very literally? Well, I stumbled across some research. Actually, it's in a field that is now, or in a diagnostic category that I understand is now blended in with autism, and it's called Asperger's. So I thought this might be fitting to blend in with some of the other topics that I've spoken of in this channel recently to help encourage people to develop their soul, their spirit, their feelings and their perceptions that they can augment with their mental and their technical intellect. So let me share some Asperger's research to enlighten people who, quite commonly I was disturbed because I've worked with thousands of engineers and geoscientists and, lawyers and accountants that are all, very literally minded people. Some of which, who are completely well-rounded and excellent at understanding emotion and feeling and so forth. But I found there are a number of people that are isolated. So as I reached in and started doing this Asperger research, I found that there's a lot of people in those categories that are very isolated and depressed and are really struggling with some mental health issues by that definition. So, and I also find that there's a number of people that are confused by the fact that their overdeveloped technical sensibilities are often so strong that they've overshadowed, often at the expense of their spiritual, emotional, and somehow they've compromised some relationship skills. So the latest research and demographic trends regarding Asperger's syndrome, it's now often included under the broader Autism Spectrum Disorder, ASD, due in changes to diagnostic criteria shows several notable developments. One is a prevalence increase. There has been a noted increase in the prevalence of ASD, which includes what was previously diagnosed as Asperger's syndrome. This increase might be attributed to broader diagnostic criteria, better recognition, and increased awareness rather than a true rise in incidence. For instance, the autism rates has been reported as high as 1 in 36 children nationally in the US, which was significantly higher than earlier estimates. We're also gleaning a lot from genetic insights. Recent studies have continued to explore the genetic basis of autism, including Asperger's. Research has confirmed that variations in genes like GABRB3 are linked not only to Asperger's, but also to empathy levels in the general population, suggesting a genetic component to social cognition. Then there's also a diagnostic evolution. The DSM-5 no longer lists Asperger's syndrome as a separate diagnosis, integrating it into the broader ASD category. This change reflects an understanding of the spectrum nature of autism, where Asperger's is seen as a higher functioning part of that spectrum. And then there's demographic trends. While specific demographic data for Asperger's post the DSM-5 changes are less distinct due to its integration into ASD, the general trends in ASD show, in regard to gender, there's a consistent finding of higher prevalence in males compared to females, though the exact ratio can vary by study. And then ethnicity, in that category, recent data has shown a closing gap in the prevalent rates among different ethnic groups, particularly between Black and white children in the US, though disparities and early intervention persist. In regard to public health and awareness, the rise in diagnosed cases has led to increased public health focus, with efforts toward earlier diagnosis and intervention. This shift also reflects in social awareness, with more people identifying as neurodivergent, which might include those who would historically be diagnosed with Asperger's. And then there's research on brain function. Advanced neuroimaging techniques like diffusion MRI are being used to understand the physiological differences in brain structures between autism and non-autistic individuals, potentially offering insights into how Asperger's manifest at a neural level. And then there's environmental and lifestyle factors. There's an ongoing debate and research into how environmental factors, parental age at conception, and other lifestyle factors might influence the rates of autism, including what was Asperger's. From several social media posts, there's a mix of concern over raising rates of various health issues, including cognitive disabilities, which might encompass autism, and discussions around the implications of those trends on society. However, these social media posts also reflect a broad spectrum of opinions and are not necessarily scientific consensus. But in summary, while specific demographic data on Asperger's post its integration into ASD is less detailed, the field continues to evolve with genetic research, broader diagnostic practices, and increased societal awareness, all contributing to a more inclusive understanding of autism spectrum disorders. Now, in recognizing Asperger's syndrome, it's now often referred to within this Autism Spectrum Disorder, ASD. If you see this in someone that you interact with regularly and you observe a variety of these traits, then there might be signs that this person is dealing with autism or Asperger's syndrome. In their social interactions, difficulty with social clues. They might not pick up on nonverbal cues like body language, facial recognition or expressions, or tone of voice. This can lead to misunderstandings or seemingly inappropriate responses in social situations. Literal interpretation. Often they interpret language very literally, which might lead to confusion when idioms, sarcasm, or metaphors are used. Challenges with empathy. While they might understand emotions intellectually, they might struggle with intuitive empathy, making it hard for them to respond in ways that others might expect in emotional situations. Monologues over dialogues. Watch out, Mark. Conversations might feel more like monologues, where they talk at length about their interest without noticing the other person's disinterest or desire to change the topic. And then there's a category of behavioral patterns. An intense focus on interest. They might have one or more very specific interests that they pursue with great intensity, often at the exclusion of other activities. This could be anything from a particular genre of music, a historical period, or a scientific topic. Routines and rituals. A strong preference for routines and a resistance to change in those routines. This can manifest in daily schedules, specific ways of doing things, or even in how they organize their workspace or home. And then there's sensory sensitivities. They might have unusual reactions to sensory input, like being overly sensitive to light, sound, textures, or smells. This might lead them to avoid certain environments or wear specific types of clothing. And then there's communication categories. Speech patterns. Their speech might be unusual in rhythm, tone, or pitch. They might speak in a monotone, or their voice could be unusually loud or quiet. They use repetitive phrases. Sometimes they might repeat certain phrases or use language in a repetitive way. And then another category is physical behaviors. They have repetitive movements, looking for repetitive behaviors like hand flapping, rocking back and forth, or other self-stimulatory behaviors, which can be a way to manage sensory input or express excitement or anxiety. They can have clumsiness or awkward moments. They might have motor coordination issues, appearing clumsy or having like an awkward gait. And then there's cognitive characteristics. Attention to detail. They might excel in noticing details that others miss, which can be an asset in professional settings, but can also lead to being overly focused on minutiae, especially in your personal life. Systemizing. A strong drive to analyze or construct systems, whether they're abstract concepts or mechanical systems or social rules. And then there's several items in professional settings, like their work style. They might prefer solitary work or tasks that involve a high level of detail or routine. They could excel in roles where their special interest or abilities are utilized, but might struggle with a team dynamic or client-facing roles unless these are structured in a way that suits their communication style. And then in social settings, like social gatherings, they might avoid these altogether or feel uncomfortable in large social gatherings unless they have a specific role or a task that gives them a sense of purpose or structure. So if you notice these traits, it's important to approach the situation with sensitivity. If you're concerned or curious, consider your observations with the individual privately. Focus on how you can support them rather than labeling them or diagnosing them. Remember that only a professional can really diagnose, and many people with Asperger's or similar traits lead fulfilling lives with appropriate support and understanding. For individuals diagnosed with Asperger syndrome, now under the ASD, there's a range of treatments and therapies available. And these aim to improve their quality of life, enhance their social skills, and manage co-occurring conditions and support personal development. Here's some of the key approaches. Behavioral therapies. Applied behavioral analysis, ABA. While more commonly used for younger children or those with more significant needs, elements of ABA can be adapted for individuals with Asperger's to help them with social skills, communication, and reducing challenging behaviors. And then there's cognitive behavioral therapy, CBT. This can be particularly effective for managing anxiety, depression, or obsessive-compulsive behaviors, which might occur with Asperger's. CBT helps individuals understand and change thought patterns, leading to harmful behaviors or emotions. And then there's social skills training. There's groups. These are often structured around teaching social cues, conversational skills, and appropriate social behaviors in a group setting, which can be less intimidating than one-on-one interactions. Role-playing and social stories. Techniques where scenarios are acted out or described to help individuals understand social expectations and appropriate responses. And then there's speech and language therapy. Speech therapy, while individuals with Asperger's typically have good language skills, they might benefit from therapy focused on pragmatic language, how to use language in social context, or prosody, the rhythm, stress, and intonation of speech. And then there's occupational therapy, OT. This helps with fine motor skills, sensory integration, and daily living skills. For adults, OT might focus on workplace accommodations or managing their personal space. Another category is sensory integration therapy. This therapy helps individuals with sensory sensitivities by gradually exposing them to sensory stimuli in a controlled way to help them cope better with sensory input. These people often need educational and employment support. Individualized education plans, IEPs, are available for students that are tailored education plans that can help them address their specific needs, providing accommodations like extended time on test or a quieter testing environment. And then there's vocational training, programs that focus on job skills, workplace, social dynamics, and finding employment that matches the individual's strengths and interests. There's also medication. Well, there's really no medication for Asperger's itself. Medications might be prescribed for occurring conditions like antidepressants for anxiety or depression, or stimulants for attention deficit hyperactivity disorder, ADHD, if that's present, or antipsychotics in some cases for severe behavioral issues or to manage anxiety or mood swings. I mean, imagine if you had this kind of condition, how frustrating it would be living in our culture, in our lifestyle, where everything is conformed and trained. There's also family therapy. This helps families understand and support the individual with Asperger's, addressing family dynamics and providing strategies for communication and behavior management. And there's support groups, peer support groups for both the individual with Asperger's and for family members. I mean, these groups provide emotional support, practical advice, and a sense of community. And there's alternative complementary therapies like art, music, or drama therapy. These can be beneficial for emotional expression, social interaction, often in a less conventional setting. And I think this might be where people could be encouraged to find what their real gifts are and where their spiritual callings might be, or what what has been suppressed in their upbringings that needs to be brought forward to express and get more comfortable with in more of an artistic, self-expressive setting. And then there's animal-assisted therapy, where interactions with animals can help reduce anxiety and improve social engagement. And there's lifestyle and environmental adjustments, creating structured environments at home or work, maintain a predictable routine, that can help you reduce anxiety. Good old physical activity, regular exercise can help manage stress and improve your overall well-being. There's also technology-based interventions available today. There's apps and software. There are numerous apps designed to help with social skills, emotional regulation, and organizational skills tailored for individuals on the autism spectrum. So when considering these treatments, it's crucial to tailor the appropriate approach to the individual's specific needs, strengths, and challenges. Often a multidisciplinary approach yields the best results, involving professionals like psychologists, occupational therapists, speech therapists, and educators. Additionally, involving the individual in decision-making about their treatment can empower them and lead to better outcomes. And, I have to say today that you need to consult with a healthcare professional. See what your options are to determine the most appropriate interventions. And I have to also say that the likelihood of men in their 40s to 60s who are isolated may be financially successful but struggling in relationships may show some signs of Asperger's or similar spectrum disorders that it involves considering both general demographic trends in autism spectrum disorders and specific traits associated with Asperger's syndrome. And, here's some analysis based on the information that's available today. The general prevalence of autism, including what was previously diagnosed as Asperger's, has been increasing. Recent figures suggest that about 1% of the population might be on the autism spectrum, with variations based on diagnostic criteria and awareness. However, these statistics don't specifically isolate men in their 40s to 60s who are financially successful but isolated. There's also some characteristics that might be in alignment. Men with Asperger's often exhibit traits that could lead to a scenario of social isolation, being difficult with social cues, a preference for solitude, or challenges in forming and maintaining relationships are very common. This could lead to isolation, especially if not diagnosed or supported early in life. There is a lot of professional success in this group. Individuals with Asperger's might excel in fields requiring detail-oriented work, pattern recognition, or specialized knowledge, which can lead to financial success, especially in technology, finance, or other analytical professions where their unique cognitive strengths are advantageous. But don't deny the relationship struggles that these individuals may encounter. The social and emotional reciprocity challenges them. Often, these are associated with Asperger's and can make personal relationships very difficult, leading to misunderstandings or unperceived emotional cues, making people unavailable. The social media surveys, while not providing specific statistics, there are posts that suggest a higher incidence of neurodivergence, including autism in certain groups like incels, which might share some overlap with the demographic in question here of men 40 to 60 who are financially successful. However, these posts in social media highlight the variability of how autism manifests, suggesting that while there might be a higher likelihood, it's not universally applicable. Now, the consideration for this demographic where late diagnosis has occurred, many adults, especially those later in life, might have developed coping mechanisms or found niches where their traits are less of a hindrance or even beneficial. This could explain financial success despite personal struggles. And then, of course, there's also people that are misdiagnosed or underdiagnosed. Men in this age group have been misdiagnosed or simply never diagnosed due to awareness or different diagnostic criteria in their youth. The probability estimation, given the traits and consideration of general ASD prevalence, while not all isolated successful men in this age group, 40 to 60, have Asperger's or a similar disorder, there's likely a higher incidence than in the general population due to the alignment of traits. However, without specific studies targeting this demographic, we're left with just being speculative. But we do consider that around 1% to 2% of the population might be on the autism spectrum, and if we speculate that traits leading to professional success but personal isolation might be more in common with those with undiagnosed Asperger's, perhaps this group might see a higher rate, but still within a reasonable range of 2 to 5%, or higher if considering only those with pronounced social difficulties. So there's No definitive statistic directly linking this demographic to Asperger's or similar disorders. The combination of traits described suggests a higher likelihood than in the general population, potentially due to the unique way Asperger's can manifest in professional success alongside personal challenges. However, this remains an educated guess based on trait alignment. Keep in mind that discussing concerns about Asperger's or similar spectrum disorders with a loved one requires sensitivity and understanding and a strategic approach. And here's some thoughts based on general best practices and insights from various sources. Educate yourself first. Before discussing, educate yourself about Asperger's syndrome. Understanding its traits, challenges, strengths can help you approach the conversation with empathy and knowledge. Number 2, choose the right time and setting. Find a quiet, private, comfortable setting without interruptions. Timing is crucial. Avoid moments when they're stressed or preoccupied. Use I statements. Frame your concerns from your perspective to avoid sounding accusatory. For example, I've noticed that sometimes we struggle to communicate, and I wonder if this might be a reason for it. Be specific, but gentle. Mention specific behaviors or situations that concern you, but do so gently. I've noticed, for example, that you seem to prefer routines and get very anxious when they're disrupted. I'm just wondering if there's something more to this. And then express concern, not a diagnosis. Avoid diagnosing. Instead, express concern for their well-being. I care about you, and I want to understand more about what you're going through. Have you ever considered that it might be something like Asperger's at play? And then listen actively. Give them space to talk. They might share feelings and experiences that align with Asperger's traits, or might reveal they've had similar thoughts. And then offer support, not solutions. Make it clear that you're there to support, not solve their problems. Like, if you ever want to explore this further, I'm here for you. Maybe we could look into it together, if that's what you want. Maybe suggesting a professional consultation would be appropriate. If they're open, suggest seeing a professional who specializes in Autism Spectrum Disorders. Maybe talking to someone who knows about these things could help us understand this better. It's important that you respect their response. They might react defensively or dismissively. I understand this is something that you don't want to talk about now, but I'm here whenever you're ready, is something you could say. And then follow up. If they're receptive to it, follow up with more information and resources. If not, don't push, but keep the lines of communication open. Prepare for various outcomes. They might already know and be in denial and not ready to discuss. Be prepared for any reaction and respond with empathy. Encourage self-reflection. If they're open, encourage them to reflect on their experiences. You might ask them, have you ever felt like your way of thinking or interacting is different from others? Avoid labeling. Focus on behaviors and feelings rather than labels. It's not about labeling you, but understand why certain things might be challenging for you. Highlight their strengths. If appropriate, mention how traits associated with Asperger's can also be strengths. I've always admired how you focused and been so detail-orientated. Be patient. Change or accepting might not come immediately. Patience is key in supporting someone through this realization. Remember, the goal isn't to diagnose, but to open a dialogue that might lead to understanding, acceptance, or seeking professional help. Your approach should be supportive, informed, and driven by genuine care for their well-being. If handled with sensitivity, this conversation could be a step towards better understanding and support for your friend, for your loved one. I'm Roach Mark Roach, wishing you all the best.